Hello, anatomy colleagues. This is Dr. Alsop, and in this video, we are going to be discussing the bones of the wrist and the hand. So, this is an area where the bone number count really goes up. So, it makes sense that we have more learning objectives to work through, but I think you'll actually find them fairly straightforward as we make our way through. So we will start with the carpal bones, which are often referred to as the wrist bones. There are 8 carpal bones total per upper limb, and these 8 are divided into 2 rows. So you will have a proximal row, which is composed of 4 bones, which I'm not going to have you memorize each name of each carpal bone. Only the ones I mentioned specifically are the ones you are responsible for knowing their names. And the only one in this proximal row right now that I'm going to have you know is the pisiform. So almost all of these proximal carpal bones are going to articulate with the radius at that radiocarpal or wrist joint. The only one that does not is going to be the pisiform, which is because it's too anteriorly placed. And it's an example of a sesamoid bone. It actually forms within the flexor carpi ulnaris muscles tendon. The distal row of carpal bones also has 4 bones, and these articulate with the metacarpals. So we have talked about Fuchs injuries in all of these upper limb bone videos, and we are going to talk about it here as well. Recall Fuchs stands for fall on an outstretched hand. And with this type of injury, you can fracture carpal bones, and most frequently you would fracture the scaphoid bone. And this is going to be the lateral most carpal bone of the proximal row. Scaphoid fractures are often misdiagnosed early. And what I mean by that is often right after an injury, an individual may get a radiograph or x-ray. And the scaphoid actually doesn't show a fracture. But it's not great to misdiagnose a scaphoid fracture because the blood supply to the scaphoid is weak, and it's also what's called retrograde. So if the fracture disrupts those few vessels, that can cause what's referred to as avascular necrosis or bone death if not treated. So often, even if a fracture doesn't show early in a radiograph, physicians will still treat it as if there is a fracture to help prevent avascular necrosis. The carpal bones are an important component of a region called the carpal tunnel, which is an anterior concave space in which the carpal bones form the floor as well as much of the wall as well. And a ligament is actually going to form the roof. And this ligament goes by different names. The proper name is transverse carpal ligament, but much more frequently you see it referred to as the flexor retinaculum. Those two terms they mean the same thing. Now, what's really important here is what traverses the region, and it is packed in there. These structures are really filling up almost all the space in there. And the majority of what is located in there are long tendons of the flexors, which have their muscle bellies in the forearm, but the tendons, those distal attachments will be on bones in the hand. So this is how they're getting from the forearm to the hand. Additionally, these tendons will have bursal specializations called tendon sheaths, which surround it. And then traveling with all those tendons is a pretty big nerve, just labeled nerve in this illustration here, but this nerve is called the median nerve. And this median nerve is of particular importance in a pathological condition called carpal tunnel syndrome. And what happens in carpal tunnel syndrome is the carpal tunnel space decreases, and that's often caused by an increase in the size of the structures in the carpal tunnel. Specifically, it's usually swelling of the tendon or those tendon sheaths, so kind of a form of bursitis. If those things get bigger, the space gets smaller, that can compress the median nerve. And the median nerve is primarily a sensory nerve to the hand. So if you get tingling or diminished or lost sensation for its territory on the lateral side of the hand, that could be an indication that the median nerve is being compressed. The median nerve also has a motor component to it as well in the hand, specifically to muscles that will move the thumb. So in severe cases or very long cases of carpal tunnel syndrome, you can have weakness to those muscles, so weakness in the movement of the thumb. All right, let's move distally, and we are at the metacarpals now. These are the bones that are located in the palm region, and these are the longest bones in the hand. Again, not nearly as long as, say, the humerus or the radius or ulna, but these are the longest of the long bones in the hand. There are 5 per side, and they are numbered 1 through 5 from lateral to medial. So the first metacarpal is lateral and is associated with the thumb. Then we go from there. So we have 2, 3, 4, and 5. That fifth metacarpal is associated with the little finger or the pinky finger. These bones articulate proximally with that distal row of carpal bones to form the carpometacarpal or CMC joints. And then distally, they will articulate with the proximal phalanges to form the metacarpophalangeal or MP joints. Last but not least, we have the phalanges, and some good news. If you learn this pattern in terms of the phalanges, it's very similar to the digits in the foot. So that will save some brain space when we get to that region. There are 3 sets of phalanges. You will have the proximal phalanges, of which there are 5. There are 4 intermediate or middle phalanges. So there's actually 1 less because there's 1 less than the proximal and the distal because the first digit does not have a intermediate or middle phalange. And then last but not least, we will have the distal phalanges, of which there are 5. So returning back to that first digit, the joint between the proximal and distal phalange is just called the interphalangeal joint or the IP joint. But we have 2 types of interphalangeal joints in digits 2 through 5. There are going to be the proximal interphalangeal joints. We often just refer to these as the PIP joints between the proximal and intermediate phalanges. And then we'll have the distal interphalangeal joints, which are going to be located between the intermediate and the distal phalanges. And all of these interphalangeal joints are examples of hinge joints. All right, practice question time. In anatomical position, the first metacarpal is best described as lateral or medial to the other metacarpals. So break out your best anatomical position. If you can, visualize this on yourself. And hopefully you are landing on A, lateral, being the correct answer. The bones of the hand are numbered 1 through 5 from lateral to medial because the palm faces forward in anatomical position. So the first digit in the metacarpal are lateral and associated with the thumb, whereas the 5th digit is medial and associated with the little or pinky finger. All right, excellent. Thank you so much for your time and attention.